Hi everybody. Today I'm gonna talk a little bit on the burn scar and the keloid scars. So how this is gonna be treated and what are the new approaches or the alternative methods what we talk. First let's understand what is the burn scar and the keloid difference. So burn scar can happen due to any injuries or happening because of the fire accident or because of any thermal injuries due to excess heat or whatever. But the keloid is the one which is going to form post the burn scar. Post the scar formation. So once there is a scar, and if the scar is going to get multiplied in the healing during the healing process, so there is a collagen buildup. So in the normal individual, this collagen buildup stops at certain point. But in the case of keloid, that particular person or the individual keeps producing the collagen without knowing the where the end process. So this can be due to genetic or due to the DNA sequences. So there are so many number of reasons for the keloid formations. So this can happen in any injuries, even a normal cut injuries also these issues could be there. But when the scar is bigger or the area is bigger or the deeper, so the tendency of formations are much more on a higher chances. So the keloid is forming post the scar formation. So it's not that directly there is a keloid. So the keloid slowly becomes a hypertrophic, then hypertrophic scar can go to a keloid formation. So it's better to address the scars at the initial stages so that we don't land up in one of these issues. Now coming to the treatment aspect, so there are various modalities of treating the scars. The most effective of them being the lasers. We have different types of lasers, so that ablative and non-ablative lasers. So the most effective being the ablative lasers, that is the CO2 lasers. So we can do a combination as we have all the lasers with us. So we try to combine without having a downtime or without having an hyperpigmentation. That means the treated area getting more darker or getting more burns once again. So these things can be avoided with our FDA approved lasers. So we use one of the world's best luminous lasers. So wherever you go, you should know what technology is being used on you. Can be CO2, but who's manufacturing this CO2 or who's manufacturing this non-ablative lasers. So this is the most important factor in the total outcome of the treatment. So you need to have a quality of the device, the FDA approvals for the set procedure, for the set technology, then you opt the treatment, then you will find a definite results. And coming to the type of lasers, as I said, ablative and non-ablative. So we have both, we combine this both and we try to give you the best effects to avoid the complications or any side effects. Side effects like the area getting darker, as I said, or getting more scars or more burns and downtime like skin peeling, burning, itching, pus formation. So these are all outdated. So nowadays nobody wants all this. So you can come to us as a lunchtime procedure, get the procedure done and go back to your work and do everything without having any downtime. But definitely yes, there are few things which you need to take into precautions like no hot water shower or no getting direct sun exposures like SPF usage. So all these instructions would be given to the post the procedures and you can carry on with day-to-day work without taking any further off. And coming to the pain, yeah, ablative lasers has little bit of a pain during the procedure. To avoid that also we put a numbing cream, that is something like application like a ointment or a cream, and we give some 20 minutes to 35 minutes gap and then we do the procedure. Probably you may find like a small sting. So apart from that there are no other discomfort, and especially post procedures there are no much discomfort like you need to take painkillers, antibiotics. So there is nothing like that. There are no medications. We don't advise any medications, no steroids, no antibiotics, nothing. So we leave it for the natural healing to happen, which will give you a best results. And coming to the number of sessions, usually these lasers take 8 to 10 sessions depending on the scar type, can be more or can be less. So unless we do a clinical examination, we wouldn't be in a right position to come on number of sessions. But yes, averagely 8 to 10 is one for our skin type, that is our Asian skin type. So Caucasians are the skin type of 1, 2, 3. The sessions can be much lesser than this. And coming to the type of the lasers how we combine depends on the lesion or again on the type of the scar. So depending on that we can try and give you the best results possible. So nowadays the newer approach is combination treatment, where we had few samples of cases done, and in these samples I have selected 50 samples for just for the keloid of surgical excision, and then giving a primary or a closure, and then waiting for it how it stabilizes. And the next one being only with the intralesional injections. So this has been our conventional method of usage since ages. And the newer approach, which we have documented and presented this paper in the pre-COVID times 2019 in Istanbul, and this has been awarded as one of the best papers, where we had a combination of treatment of Botox, intralesional injections and CO2 laser. So we have got an amazing results, and we have posted this on our social media handles and our website. And so depending on the conditions, we try to give a different approach. As we have all the technologies being in our center, we are equipped to treat the best and give you the best outcome, and you should come and try our technologies and our expertizations. Thank you.